Okay. All right. Welcome. Hi. Welcome everyone to LGBTQ Health. I want to thank Candy for inviting me. This is super exciting. This is the work I love doing. As an introduction, my name is Jamie Erdheim. I have been doing LGBTQ work for around 9 years. I look young, but I'm not that young, I promise. And across different settings. I'm also a health educator, so I've worked in school-based health centers, I've worked in colleges, K through 12, youth-serving organizations, different things like that. So I've worked across systems and settings, and especially in healthcare systems, so I'm a little bit familiar with that. I currently am the youth advocate at the Milwaukee LGBT Community Center, and I've been there for about 6 months. I'm from New York, actually, and I got my master's from Harvard, so I went to school in Boston, and I also was in a PhD program for a few years, so I'm a little bit kind of research savvy as well, and I moved back to the Midwest for this job, but I love the Midwest, so I'm happy to be here, even though I'm from the East Coast. I really like the Midwest. So that's me, and this is a subject that's super important to me, and it's really important for kind of healthcare settings to really be aware and affirming and really think about how we can have good patient care for LGBTQ patients. So I normally don't do objectives, but they are very useful, so I thought I would do them today because a lot of people will be seeing this. So our objectives for today are first to self-reflect and examine how our identities affect how we might treat LGBTQ patients, because we all don't come in with a blank slate, right? We're not just random kind of people living in a vacuum. We have experiences, we have backgrounds, we have identities, and that affects the work we do, right? Everyone. And then our second objective is to learn basic LGBTQ terminology, and that again kind of varies depending on where you're at, right? Your own experiences and background, but it will be a very kind of basic overview and then go into some terms that I think are more common right now in 2018. And then our third objective is to understand the levels of different disparities in order to better understand patient experiences. I am an ecological kind of psychologist, so for me that means that I think a lot about the different systems within our society, not just individual, but beyond that. And then the last thing, which is probably the most important, it's the practical skills piece, is to be able to name barriers to accessing healthcare and strategies for reducing these barriers to better serve LGBTQ patients. So let's just get into it. All right, so looking inward, self-reflection. We all have all of these things, right? We all have a race, we all have education, we all have class, age, sexuality, ability, gender, all of those things, right? So that's kind of our location socially. Kind of right now as we move through the world and navigate the world, we have all those things, and that's how we interact with people and how people interact with us. So really thinking about, especially as providers, how our lens affects the work we do and how we kind of go through, our job, basically. So intersectionality is kind of a buzzword, but it was a hat tip to Kimberly Crenshaw, who was a Black feminist legal scholar. She created the term intersectionality, which is really the idea, it's kind of by and for Black women, but it's the idea that multiple identities intersect in unique ways and affect people in unique ways. And there are different unique barriers based on different multiple identities intersecting. So, like I was saying,
can you repeat that?
Yes, sorry, yes. So to repeat, intersectionality is this idea that different pieces of your identity intersect and affect you in unique ways. It's not just like you have this piece, you have this piece, you have this piece, and they're all kind of separate. They all interact with each other, right? So, we could kind of easily think of examples of that, right? Like a person who is, a gay woman might have different experiences than someone who is a gay man or a straight woman, right? Being a gay woman is a specific identity that has unique barriers, if that kind of makes sense. So that's kind of the root of what we're going to talk about a little bit today. Just thinking about how all these different pieces kind of intersect in healthcare settings and health systems. So it's kind of important to really think about where we are coming from. Okay, so this is typically interactive, but I'll kind of keep it as lecture-y as possible. So when the doctor says it's a boy or it's a girl, lots of things come with that, right? So the doctor says it's a boy, And that comes with what's expected of you, different gender roles, how you should express your gender, who you're supposed to be dating, right? All of that from jump. From the moment you're born, it's, oh, they're gonna have a girlfriend, oh, little girlfriend. Oh, like they're gonna like sports, they're gonna be strong, like can't cry, right? All of those things. And same with girls as well. The doctor says it's a girl based on genitals, basically, right? And that means, girls have to act this way, wear pink, wear dresses, be a caretaker, all of that, right? So that is from moment one. All of that is present. And so thinking about that, again, like kind of throughout our lives, how that might affect someone who is LGBT, right? So I normally ask this question, when were you first aware of like gay or lesbian or bisexual people? And for a lot of people, it either happens maybe with a family member, maybe at school, maybe through media, but a lot of people don't have a lot of super salient experiences until maybe later on in life, right? And thinking about how that can be very isolating for LGBTQ folks, to not see people around you or not hear people talking about it, right? This identity that you might have, but you don't even know is a thing yet, right? Or you might not know what to do with it because it's not common, it's not the norm, people aren't talking about it. And then especially for transgender folks, which we'll get into all the definitions, but for people who don't identify, the doctor says it's a girl, and the trans person says, I don't think that's true, that's not true for me, that's not how I feel about myself. That comes even later, right? Usually when I do these presentations, most people are like, oh, I didn't even know that was a thing until maybe college, right? That can happen even later. And that must feel, right, super extra isolating for someone to have these feelings and not see it anywhere around them, right? Normalized or affirmed or anything like that. So really thinking about like how our experiences growing up and how that might be different for LGBTQ folks. Okay, I like memes, sorry, this is a Drake meme, but, and I'm sure we talk, most provider kind of public health, all that kind of stuff talks about cultural competency, right? So it's this idea that you can learn about a culture. You can learn all the things you need to know about a culture, and therefore you can kind of work with those people, and it's like, it's fine, because I know enough about this type of identity or this type of culture. And I kind of push back against that. And kind of the newer thing is this idea of cultural humility, which is this idea that as an outsider, you can't really know everything about kind of someone else's culture, and that's okay. It's really just about committing yourself to a process of learning, right? Like we all are, like none of us have all of the identities. None of us are part of every culture. That's just not possible. So really committing to this idea that there's always more to learn over your lifetime, and that is okay, and just being open to learning and embracing kind of the complexity of experience. Like I can say, I as a queer person experience XYZ, that doesn't mean that another queer person experiences those exact same things, right? So kind of not assuming that there's one gay experience. So that's kind of, again, where I'm coming from, a very important framework. Yeah. Okay, terminology time. Even though I just talked about how I don't really love the idea of competency, this is a little bit of a competency training. Because although it's still important to be open to learning and open to, actually asking about the complexity of your patient's experiences, it's still good to have basic knowledge so your patient doesn't have to educate you on their identity, right? Because they're there to get care. They're not there to teach you. So we'll start with the basics. LG, the most common, lesbian and gay. Someone who experiences romantic, emotional, and or sexual attraction to people of the same gender. Pretty common, right? Most people know lesbian and gay. Okay, B. So there's been a lot of people have very different thoughts about bisexual. There's been a lot of kind of invalidation even within the LGBT community around bisexuality. So even I would say like the LG is kind of the most privileged within LGBT, and then B is kind of underneath that, and then T is like thrown under the bus consistently. But yeah, bisexual is someone who experiences romantic, emotional, or sexual attraction to people of the same and or other genders. So the kind of original sort of definition of bisexuality was kind of a gender binary. So it was kind of, attraction to males or females. And kind of the newer kind of definition of this kind of allows for a variety of gender. So kind of the more accurate sort of term right now is same or other genders. We'll probably talk a little bit more about that later. And I will say also for bisexuality, that doesn't mean that it's like, 50-50, right? Like I like this gender half the time, this other gender half the time. It could be a variety of things, right? Okay, and then T, which is different than LGB, because LGB are sexual orientations, right? So it's how you interact with other people, how you feel about other people, how your attraction to other people. T is a gender identity, right? So T, transgender, it's your own, how you feel about your own self, right? Is an identity about yourself. So T, and this is I think less understood than LGB, because gender is complicated, but someone whose gender identity, right, does not match the sex they were assigned at birth. So a doctor is like, oh, I see you have a penis, so that means it's a boy. And then a trans person might be like, no, that's really not how I identify. That's not how I see myself. That's not how I feel. Okay, and Q can be two things. Q can be questioning or queer. Questioning is super important to include in there because there are a lot of people who, again, are questioning their sexual or gender identity. So they might not like identify within the community yet, but they're still kind of thinking about it. They still have needs. They still have kind of specific, things that we have to think about. And then queer can be an umbrella term. It's kind of a more political term, just kind of an identity where it's sort of a like outside of the norm, outside of the binary. I identify as queer, and that's a big, we can talk about queer forever, and every person identifies and defines queer in a different way. So that's kind of a tough one. But my definition is it's kind of a more political term, like attracted to all genders. Yes?
Can you move throughout? I would think you could.
Yes.
So would queer or questioning be more of a state where you kind of move throughout?
Can you repeat the question?
Yes. Okay, so the question I was just asked is, especially for queer questioning, are these ones where you can move throughout, right? Like throughout the letters?
Mm-hmm.
Yeah, that's a great question. So definitely sexual and gender identity is contextual. So I'm gonna get a little into that later too. And it can be very fluid, right? So if you're questioning, for sure, definitely a lot of questioning folks move into another letter when they're kind of like, oh, I like kind of figured this out more. And at the same time, for queer, sometimes that could be just a lifelong term. But you are right, and someone can also identify, someone could be trans and also any of these other letters, right? Because it's a gender, and then you also have a sexual orientation. So yes, you can definitely move through the letters or identify as multiple letters. Yeah, thank you, that's a good question, thank you.
And you also, we're talking about more like a hierarchy, like LGB
Yes, there is a hierarchy.
is a certain, that's more acceptable, where
Yes.
Maybe the bi is below that, and then
Yes.
trans, but where does
Yeah.
queer fit in that? That's where I just to grasp that a little bit better. I know you said it's more political, but.
Sure, yeah, thank you. So the question was, where does queer fit in kind of the hierarchy of LGBT? That's a really good question, because a lot of people, so queer used to be kind of a derogatory term, right? For a lot of older folks, queer was used in a negative way. And the reclaiming of queer is kind of a newer idea, right? Probably like my generation. So that's kind of a big part of it, right? It's this political, like you use this word against me and now I'm gonna use it as an identity. So I would say queer in the hierarchy would probably be around same as B, like bisexual, because it's kind of this more still fluid, kind of open, I'm attracted to multiple types of people, and there are some people that still kind of don't think that's really a thing. So yeah, so like lesbian, gay, because that's the easiest to understand and grasp, and then kind of bisexual or queer, because it's a little bit more fluid, and then trans, because people don't understand a lot of gender stuff. So does that kind of make sense?
Yeah.
Okay, yeah. So I think it's important to really, to like think about that just because someone's part of the community doesn't mean they're like totally on board with all other parts of the community, right? So getting back to the kind of humility piece, that not all gay folks have the same even types of acceptance, right? And even especially what's in the media, right? Who's represented in the media? Not a lot of BTQ, mostly L or G, mostly G, right? So, okay, so we're gonna kind of get a little bit more into beyond 101. So an ally, right? So we all are trying to be allies to different communities. So for me, my definition of ally is someone outside of the community who actively works to dismantle homophobia and transphobia, right? So those really systems that are really discriminating against LGBTQ people. aromantic. So aromantic and asexual are ones that I would say, since I do a lot of youth work, are ones that kind of younger folks do like identify as a lot. I don't really know that many probably older folks who, because they didn't have this language, they probably didn't know that this could even be a thing you could identify as or be a part of this community. But I work with a lot of people who identify as aromantic or asexual. Asexual is kind of more of a known term. So it's just this idea that you can feel little to no romantic attraction or little to no sexual attraction. And again, that can be on a continuum, right? That can be based on a lot of different things. You okay?
Yeah, no, I'm just trying to, again, wrap my head around that. So it just seems like there's just so many identifications now, like it's become a plethora of.
Yes, a plethora of identities. That is true. Yeah.
So no romantic attraction and no sexual attraction. I guess I think of it as romance is an emotion, and the sexual attraction is the acting on the emotion. Is that correct?
A little bit, yeah. So I think someone can have sexual attraction and no emotional attraction, right? You're just attracted to someone. Someone can be aromantic but not asexual, right? So they can like have sexual feelings but not necessarily feel romantic feelings or emotional feelings, and vice versa. So you're like right, and also I think it can be still a little bit like you can still, asexual people still date, right? Because they could date and not necessarily engage in consistent sexual behavior. Aromantic people can date, but it would look differently, right? Because it wouldn't be this romantic kind of connection.
Okay.
But yeah, so, and also kind of similar idea, aromantic and asexual people can also identify as LGBT, right? Because you can be asexual, but still romantically be attracted to, whoever, right? You can be gay and asexual, for example, or, lesbian and aromantic. So I know it's I will say, a lot of newer identities and labels. And some people are like, oh, why so many labels? Like, whatever. But I think also it's kind of this affirming, like, oh, I felt alone, I felt isolated, I didn't know there was a community for that, I didn't know there was a word for that, and now there's a word for it, and there are other people talking about the experience I'm feeling, and that's like super powerful, right? Like that's, like finding your community is super important, especially for some of these where it's not super common, right? So, okay, and then pansexual is another very common one now that I hear of a lot. People identify as pan. They go, oh, I'm pan. And it's kind of similar to bisexuality, right? It's this idea that you're attracted to a lot of different types of people. But for pansexual folks, the kind of main definition that I typically hear is that you're attracted to people regardless of gender. The gender of the person doesn't matter. You kind of just really like that person. Does that kind of make sense? Like the gender is kind of this, like, on the back burner. It's not. Yeah.
Sorry, I hate to keep interrupting.
No, that's okay.
Should it be called pangender? Or, because isn't there a difference between sexuality and gender?
Yes, yeah. So it's, the sexual part is because it's about attraction. So it's like your sexual, attraction is regardless of gender. Pangender is a thing, but that's around, again, a gender identity. So that would be like your own gender, can like change over time, or you have different thoughts about your gender, or you might not have strong feelings about your own gender.
Okay.
Yeah, so
it's a little confusing, but...
A little confusing, yeah. So, it's a little confusing, but pansexual kind of would be under the LGB, right? So it's like another kind of option that's similar to B, like who you're attracted to.
Okay.
Yeah, but I will say that's, again, kind of, if you're working with younger people, that would be good to know. If someone's like, oh, I'm pan, and you're like, what? So similar to bisexual, right? So that they're attracted to multiple types of people is kind of the important piece of that. And again, just to clarify, a lot of these, there's a million terms, contextual, they can mean different things to different people, right? So someone who's pansexual might have a slightly different definition of that, but this is the most commonly kind of accepted one. But a lot of times bisexual and pansexual are kind of lumped together. Like, for example, at my job, we have a bi-pan support group, because the idea is that you are attracted to multiple genders and how that affects kind of how you go through the world. So they're often grouped together. Yeah. Okay, and then a few more, and then we'll get to some gender stuff. So, same gender loving, this is kind of an older term, but a lot of members of the Black community use it as an alternative to gay or lesbian, because the kind of traditional kind of lesbian or gay movement wasn't necessarily super anti-racist, right? So a lot of Black folks were like, we're gonna think of another term, like we'd rather go by this. So you might hear for some older kind of folks of color, SGL. I don't really hear that with young people, but with some older people, that is a thing. And then this is kind of a more public health term, but down low, if you've heard of that, is a term typically used by men who have sex with men, MSN, right, but who identify as heterosexual. So they're on the down low about it. And I think this is a good kind of one to talk about how identities and behaviors don't always match. Someone can identify as a certain thing and not necessarily engage in that behavior, right? So they could say, oh, I'm gay, but they might not necessarily be engaging in same-sex behavior for various reasons. Or more likely, they would identify as heterosexual, but kind of behaving in a different way for a lot of reasons, right? Stigma, etc. And then kind of the root of all of this is this idea of heteronormativity. So going back to when you're a kid and someone being like, oh, you're gonna have a girlfriend, you're gonna have a boyfriend. And I still get this as an adult, right? Like, oh, what's your boyfriend's name? I'm like, oh, nope. So it's the assumption that all people are heterosexual, right? And that heterosexuality is the norm, right? So you meet someone, you assume they're heterosexual, and then kind of on the flip side, the same idea is that the kind of stigmatization and the denial and denigration of anything non-heterosexual, right? So kind of homophobia fits under that. And that's present throughout everywhere. Okay, so now we're gonna get into gender, some gender terms. Any other questions around terms that are around sexuality or sexual orientation? Cool, okay. All right, so gender, which people I think don't talk about as often as they talk about sexual orientation. So again, gender identity, someone's internal sense of what their gender is, right? Not always correlated with the sex assigned at birth, which is typically based on sex organs, right, or genitals. Intersex, huge one for the medical and healthcare community. So intersex is kind of breaking down the idea that even sex is a binary, because there are lots of different things within intersex. So intersex is the idea, kind of the old term you might have heard is like hermaphrodite, right, which is not a great term. Covers a variety of conditions where people are born with, chromosomes, hormones, sex organs, genitalia that differ from typical definitions of male and female. And it's actually super common. It's, I think, maybe 1 in 2,000 as a conservative estimate. So it's as common as redheads, actually, or maybe even a little more common. So some examples of this, so someone born without a uterus, right? Someone born without a vagina, someone born with a micropenis or an enlarged clitoris, someone with different kinds of chromosomes, so like XYY, X0, XXY, etc. So the big thing with kind of the medical community with intersex is that there's a lot of non-consensual surgeries that happen when the baby is born and they kind of see that they're intersex. They'll just kind of do a surgery, right? Like if it's a micropenis, they'll cut it to make it a clitoris, etc. So really kind of the intersex kind of activist community is really kind of mobilizing around trying to stop those surgeries from happening. And a lot of times the parents don't even know what's happening as well. So that's like a big, big issue, right? Because there's like nothing wrong with being intersex, obviously. So, okay, and then going back to some gender terms, this is a really, really common one right now. Big, big, big one. Non-binary, especially for younger folks, but I think it's kind of a more commonly accepted term, or genderqueer, which is a little bit older. But it's really just this idea that a person's gender identity just falls outside of the binary. Right, they don't really feel totally male, and they don't really feel totally female. They feel somewhere in between, they feel somewhere kind of outside. They're just kind of like, no, I don't really feel like, I just feel like something else. And this can super differ between different people, right? So a lot of different non-binary folks can identify in different ways, but the general basic idea is that they are not male or female. They're kind of outside of that.
And that's a feeling from within.
Yes.
Not an external chromosome.
No.
This is just it's your self-identity.
Right, because everyone you wake up every day, right, and you kind of perform your gender in a variety of ways, right? You decide how you want to dress, you decide, right, how you want to look, what you want to do. And, for some people that's like, oh, I want to look more masculine today, right? So I'll do XYZ to feel or look more masculine versus more feminine or something kind of in the middle. So yeah, it's this idea that gender is something that you kind of construct, you put on, you feel, you express, right? All of those things unrelated to body parts.
So wouldn't a transgender person fit into that?
That's a great question. So the question was, how does a transgender person fit into that? So that depends. Some non-binary folks identify as trans, and some don't. So that's not a great answer, but that is kind of what's happening. So I would say for a lot of trans folks who identify within the binary, they're like, I feel like a woman, I feel like a man, they would not be non-binary, right? Those are two separate things. But there are some people who are like, I'm trans, I don't really identify with the sex that was given to me at birth, but I also still like have kind of fluid gender thoughts, and therefore they would identify also as non-binary. So trans can be an umbrella term, and non-binary folks can identify as trans because technically it is kind of a trans identity, right? Because you're not really identifying with the sex you were assigned at birth. But if you are a binary trans person, you would not identify as non-binary, right? You're like, I feel like a woman, so you wouldn't be non-binary.
Okay.
Does that kind of make sense? It's a little
bit.
Okay. Yeah, that's a really great question though, because there are definitely some non-binary folks who don't really identify as trans, and there are some non-binary folks who are like, yes, I'm trans, I am part of the trans community. Okay, so cisgender is kind of the opposite of transgender. So that is someone whose sex assigned at birth matches their gender identity. So most people are cisgender, right? The doctor says it's a girl, and you're like, yeah, that's true. That's like how I feel. That's how I express. Or the doctor says it's a boy, and you say, yeah, that's how I feel. That's how I want to kind of present myself. Yeah, so a lot of people don't know the term cisgender, even though it is important if you think about trans folks to think about your own identity and what that would be called. It will be called cisgender. And then kind of gender expression or presentation, right? So external display of your gender, clothing, hair, makeup, etc. And how, again, that can change, people change that up every day. And then kind of similar to heteronormativity, the kind of flip side of that is cisnormativity. So the assumption that all people are cisgender, and that cisgender is the norm. So you look at someone, they're kind of presenting a certain way, they look maybe more kind of female, and you kind of assume that they have a vagina, right? Probably. And then kind of the same idea that transgender folks are kind of less legitimate than cisgender people, or are treated worse, right? Transphobia falls under this as well. And a lot of this can come out, especially in healthcare stuff. There's a lot of cisnormativity, and we'll get into that in a little bit. Okay, so any kind of gender questions before I get into some images?
Have you seen the National Geographic on gender? Because I think it identifies. I have it in my office so you can see it. I think it identifies. I think 25 different gender expressions and sexuality. Mm-hmm. It's very interesting because I can't keep track.
Yeah.
No, I'm not being.
Yeah.
It's just really difficult to understand what the differences are.
Mm-hmm. Yes. It can be definitely, especially if like this is kind of new information, really difficult to kind of grasp it all totally. And I think really the important thing is that you're committed to kind of like being open to learning and kind of asking questions. And it's like, I might not fully understand it, but I'll respect it, right? I'll give you quality care and I'll try to, but yeah, no, totally. It's definitely one training, one lecture is not, I've been doing this work for like 9 years and it's just, I'm still learning, right? Yeah. So it's definitely a lot, totally. And for me, it's also kind of exciting to learn about, especially gender stuff. It's like, oh, there are so many different ways to like express your gender and to identify. And that's like I think it's kind of cool, but definitely can be overwhelming for sure. Yeah, but I feel like I have seen that National Geographic thing.
Well, I have it in my office if you want to peek at it.
Cool, okay,
really
definitely. Yeah, I love watching all that stuff, so. Okay, so this is a kind of, not really a tool, but something I sometimes use in presentations or when doing work with folks. It's called the Gender Unicorn, and this was actually made by a bunch of trans youth, by trans students. It's not perfect because I still don't like the fact that it's kind of still like lines, but it is kind of cool because it separates your identity, right? And you can kind of feel a little bit of multiple ways, your expression or presentation, right? So you can, I kind of feel a little feminine today, or I kind of feel masculine, or I kind of just don't really feel like either. I kind of feel maybe androgynous. And then your sex assigned at birth, right? So you have female, male, or intersex. and then it separates the sexual or physical attraction and romantic attraction. So that kind of gets at the asexual, aromantic, right? Because those can be different, right? You can be sexually attracted to men and not romantically attracted to them, for example. So this is kind of a cool little visual that kind of can help you visualize, like, oh, it's kind of maybe more expansive than I first thought, right? And a lot of youth I work with like really like filling these out. So, okay, so we probably won't watch this video, but I would encourage everyone on their own time to watch this video. It's about pronouns. And pronouns are very important. I give my pronouns, actually on the first slide it had my pronouns. That's kind of the norm, that's what I model. I think everyone should give their pronouns and ask for pronouns because it kind of really shows that you are kind of an affirming person or provider, and you're not assuming people's kind of gender, right, or their pronouns. So pronouns, especially for the people I work with, if you misgender someone, which means you might use the wrong pronoun for them, or maybe they're a name that they don't use, that can be super traumatic, right? That can be very triggering, it can be very upsetting, because someone's gender is very important to them, right? So misgendering is a huge deal. So I really encourage, especially people that kind of provide services for other people, to really think about giving their pronouns, whether in email signatures or on their name tag, that kind of thing. It's a really easy thing to do. But it's a cute video from Australia, so. Okay, so now we're gonna get into some health needs. So we did some definitions, and now we're gonna get into really kind of the health piece of it. So from here on out, I'll kind of separate things with LGBTQ, so kind of the sexual orientation needs, and then transgender health needs, because they're different, right? Trans folks have a lot of needs that LGBT folks don't have, because it's around like gender and bodies. So just fun fact, you will have patients that are LGBTQ. We're everywhere. We exist in, the tiniest places in the biggest cities. We're literally everywhere. So it's really important to know how to provide care and kind of be a little bit aware of the different sort of unique health needs we have. So LGBTQ, like I said, can be affected by, gender and race. A white gay man is probably going to be treated better than, right, like a gay woman, right? Or all those kinds of things. So thinking about the different pieces of identity outside of sexual orientation. Mental health, huge, right? That one is kind of obvious, but mental health needs, we have a lot of them. Sexual health also to me seems like, yeah, of course, because when people talk about sexual health, a lot of times they're not talking about LGBT people, right? It's very specific types of sexual health and healthcare needs. And then actually a lot of people don't even think about this, but the long-term effects of stress and how that affects your physical health. Like LGBTQ folks have higher rates of cardiovascular issues. They have higher rates of chronic illness, higher rates of asthma, higher rates of different kinds of diseases because of the long-term effects of stress, right? Because of how we're treated. And I think a lot of the other ones are kind of mental health seems more kind of straightforward, but also physical health, right? It can affect your physical health as well. And then for trans health needs, beyond the ones I just talked about, right? The big ones are hormones and surgery, right? So even if you don't necessarily know all the exact specific details around trans health, it's good to know the basic medical transitioning kind of pieces. So hormones is the big one. Masculinizing hormones and feminizing hormones. So there's testosterone for masculinizing and then estrogen for feminizing. And then there's hormone blockers, all that kind of thing. But for adults, it's mostly just T and estrogen.
Yeah. And spironolactone.
Yes, Spiro. Thank you. Yeah, Spiro. Thank you. Yep, exactly. So hormones is a huge one. A lot of people, again, trans people don't have to make the transition. Doesn't make them less trans. But kind of knowing the options and being like, hey, here are all the options, right? And you can choose whatever feels best for you. Hormones is a big one, and then different surgeries. So there's top surgery, that's a big one, right? So kind of removal of breast tissue, mastectomy, and bottom surgery. So for trans men, so people assigned female at birth, it's kind of hard. I know some people who have had hysterectomies, but it's hard. The science is not good enough there yet for constructing penises. It is very risky, not super common. Mm-hmm. So that is not a common trans kind of surgical need. Trans women, though, that is more common. That's easier to do. Removal of testes, that kind of thing. Very, more likely to happen. And then also there's also the shaving of the Adam's apple is another one. And for trans women, because hormones don't change your voice, like vocal therapy, voice therapy, that's another one. So these are kind of some of the potential needs, right, around medical transition. That it's good to know at least, like, oh, here are the things that exist, right? Yeah. Okay, so why do LGBTQ folks have health disparities? Because of a lot of different things, right? Because of the minority stress model, right? We're a minority in society and we are treated as such, and that can cause lots of stress, right? Social determinants of health, lots of environmental factors affect our health. Most of it's rooted in discrimination, right? Which, a few pathways, right, can lead to stress, worse outcomes. Avoidance of healthcare, huge one. A trans person is not going to step into a healthcare setting if they think they're going to be treated badly, right? That's just because that's a huge deal. If they think they're going to be misgendered, using the wrong name, not being really affirming, they're not going to go. They're just not going to do it, which obviously leads to worse outcomes. And then the last one is lack of access to inclusive education. Another huge one, right? For me, I do a lot of work in schools. That's a huge one, right? LGBT students never hear about healthcare needs related to them, ever. Right, so again, worse outcomes. And then I love ecological models, so I made this. It was really hard. But yeah, so the different layers, right, and the different barriers we're going to talk about kind of cut across all these different layers, and they're all nested within each other. So individual, right, that one's kind of obvious, right? How your own history, knowledge, attitude, behavior. Especially for LGBT folks, which I think is different than other kind of minorities, there's internalized stigma, right? Like if you have internalized homophobia, that affects your whole life, right? Like that can affect everything you do. And you wouldn't tell people, you wouldn't get good healthcare, you wouldn't, maybe have good mental health, etc. So your own kind of feelings and history. And then interpersonal, another big one. I deal with this one a lot. So family, peers, coworkers, family rejection, huge in LGBT folks, right? Family rejection is probably like the number one thing I hear about with youth. And yeah, it's really sad, it's really traumatic. That's also why I'd say about 40% of homeless youth are LGBTQ, right? High numbers, because they're getting kicked out of their homes. Peer rejection, also really important. If you don't have friends or a support network that you can talk to about it, that will actually like accept your identity, again, that affects your health. Coworkers, right? If you have to hide your identity from your coworkers, classmates, all that kind of stuff. All of that really, really affects your health, obviously, and well-being. And then community-based, right? So businesses, churches, hospitals, all of those things. What are the policies? A business can legally, kick you out for being gay, right? They'll be like, we don't really agree with that. Some hospitals, right? Like they can choose to not serve trans people. They're like, I don't agree with that. Like that is a legal thing. So kind of thinking about community discrimination as well. And then public policy, of course, right? That's kind of a big overarching one. So city policy, state policy, federal policy. Federal policy was getting better, now it's not, but state policy, I mean, this is, I guess, for people all over, but for example, here in Wisconsin, we don't have really good state protections. In most states, you can still be fired for being LGBT, you can be denied housing for being LGBT, totally legally. So that clearly, of course, affects your health. And then the big thing, the macro system, right? So it's all the things that affect everything else. Why is our policy so bad? Because of homophobia, right? Because people engage in homophobia or transphobia, right? All those isms. That affects every single piece of it. Family rejection, community, policy, individual, right? It's all there. And then kind of the chrono system is the idea that it changes over time, right? Nothing about this is static. We're not just living one day in a vacuum. All of these things can change over time for like various reasons, right? Okay. All right, so now we're gonna get into actual like practicality stuff. So these different barriers, this is actually based in academic research, the 4 kind of buckets of barriers that are, again, rooted in all of these different pieces, right? So the first one, huge one, again, reluctance to disclose identity when receiving care, for obviously many legitimate reasons. The second one, insufficient numbers of competent providers. most providers, like you were saying, they don't get this in their programming. They just don't. It's just not a thing that is talked about. So when a provider gets an LGBTQ patient, they don't know what their needs are. They don't know what to ask about. They don't know how to ask about it, or really to think about what should be talked about. The third, which is hard to do as an individual, but structural barriers that impede access to healthcare, of course, right? So insurance. If you're getting fired from your job, you're not going to have insurance, right? A lot of LGBTQ folks don't have good insurance. Decision-making rights, visiting rights, that's also, again, around policy. A lot of hospitals don't allow, domestic partners to visit or make decisions, that kind of thing, right? And then lack of, again, culturally appropriate prevention services. So all of these are very specific and very kind of, there are different specific things we can do to kind of reduce these barriers. Okay, number 1, reluctance to disclose. So here are some specific things we can think about. Does your healthcare setting have visual cues that signal acceptance? So if I walk into a healthcare setting as a queer person, I'm gonna look around and see if there's anything LGBT anywhere around me. If I don't see anything that looks like me or that represents me or that talks about me, I'm gonna be like, I don't trust the doctors here, right? Like I don't wanna go here. So again, this is on the website, right? Just even basic things in brochures, materials, resources. So having a gender neutral bathroom, which could just mean having a single stall bathroom, really important. The names of programs, which this is the thing people like never think about, right? So when you think about women's health, what does that mean, right? There might be like a women's center, women's health center. What does that actually mean? What are we talking about? We're talking about like reproductive health, right? We're talking about vagina, uterine health. A trans man who has a vagina or has a uterus is not going to want to walk into a women's center. He's like, I'm not a woman. Why would I do that? That's not like for me. So I think a lot of also health disparities around sexual health are around people that don't feel comfortable going to gendered kind of sexual health places, right? So men's health, that's talking about prostate health, right? Typically. Trans women, a lot of them still have prostates. They don't want to hear people talk about men's health. It's like, that's not me. I don't need that. Or a lot of trans men, for example, the providers won't talk about how they might need a pap smear. But it's like, they might need a pap smear if they still have those body parts, right? So kind of thinking about those things as well. Conflation of kind of gender and sex parts, right? That's a really, really, really big one. And why people might avoid those programs if that's not kind of affirming their identity. Or they just don't know, right? They just don't know how to take care of their own health. And the provider doesn't know. So therefore, no one knows, so it doesn't happen. Also, again, pronouns, right? So maybe having your pronouns on your name tag, all that kind of thing. Intake forms, huge one, right? People are thinking more lately about intake forms. So are they kind of inclusive? Huge, huge, huge barrier I always hear about, especially across a big kind of bureaucratic, maybe like a hospital, is that not everyone is on the same page around names, right, or pronouns. So it might be in like the electronic health record as their legal name, a name they don't use anymore. And then if the waiting room person is like, here's your dead name, da-da-da, that's super, super, super traumatic, right? They're like, that's not my name, I don't use that name. That's like very upsetting. So really thinking about how you deal with the name thing. So it's the idea of a dead name, right? So for a lot of trans folks, their birth name, they call it their dead name because it's dead to them. They don't want to hear it, they don't use it, like don't call them that. Yeah.
I know that a lot of the intake forms are necessary for insurance purposes and social security numbers. And this might sound stupid, but let's say a trans person has a dead name. Do most trans then legally change their name? Because I think that's really important because intake forms are more than just what you call somebody. They're used for insurance and other purposes, looking up old records, things like that. Yeah. So how does that work then?
That's a good question. So she was asking about if you legally change your name, that's one thing, but if you don't, how does that work? Because you do need the legal name for a lot of things. That is totally true. Some people do change their name, although in some places, and for example in Wisconsin, it's like an annoying, expensive process. So some people don't. Of course, if you legally change it, that's like fine. But I will say, you do need their legal name, but I think just beyond that, and I think most people know that too. Trans people know that they're gonna have to have their dead legal name on documents. Like, yes, of course. But I think what I mean by this is like if you as a provider, someone walks into your room, instead of just being like, oh, blah, 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 maybe just asking their name just in like a kind of, as you're talking to them, as opposed to just assuming it's like the legal name is what they want to be called. So kind of on like forms, it's good to have, I would actually say it's good to have both. On our form, we have what is your name, and then if it's different, what's your legal name? But knowing that like the name they want to be called should be kind of prioritized for like interactions. Do you know what I mean? So,
Where I work,
Yeah.
we always ask, what do you want to be called?
yes, that's a children's, right?
Yeah.
Yeah. I did something for children's residents yesterday. Yeah, you guys have a pretty good intake form. Yeah. So, right, coming in and being like, what do you want to be called? And then again, that might not be necessarily even what you can put on like the record, but just as like for interpersonally, like, oh, I want to call you by your name. But yeah, totally, like you do have to have their legal name. That's definitely true. And then again, just making sure it's like, what do you want to be called? It doesn't have to be your legal name, right? It doesn't have to be your birth name. And then again, pronouns too. If you're like, oh, like my pronouns are blah, blah, blah. Or if you kind of aren't sure, definitely just ask, be like, what are your pronouns? It's easier to do than not to, right? Gender is a huge one as well, because a lot of people on intake forms conflate gender and sex. So I think our thing is we ask both. If you really, like, sex is kind of more important for healthcare, right? Because it's like, what body parts do you have? What do we need to not worry about, but, ask about. But for gender, it's kind of like, oh, but like, how do you identify? Like, I don't want to like assume something you're not. So for us, we ask it as two separate questions. What is your gender? And then what is your sex? Because if they're different, right, then that would be important to know for healthcare reasons. But a lot of people conflate the two. So they might ask gender, but they really mean sex, right?
So just to clarify, because I think there is a lot of confusion around that.
Mm-hmm.
So when you ask someone what is their sex,
Yeah.
are you asking, you're asking what body parts they're born with or what body parts they have? Because then in the trans
Yeah,
world,
right.
it's very confusing.
Yeah, no, that's a really good question. Yeah, so, and I think that's also probably why it would also be important to really kind of know your patient's gender as well. So it's like, oh, you were assigned female at birth. Okay, so I can assume you might have these parts. But yeah, like, is this accurate? Like, what are your, what sex parts do you have? Is this correct? Right? Like, so you can kind of assume, if you're assigned female or male at birth, what they might have.
And
But if
that
they've
would-
medically transitioned, yeah.
Okay, would that be considered gender or sex? What they were born with?
Sex. Yeah, that's their sex. Body parts is all sex, right? Yeah.
So how do you go about saying that? I mean, and being sensitive, because you should be sensitive in
Yeah.
how you go about it.
Mhm.
Is there a certain way that would be recommended?
Sure.
Or, if you're asking somebody, what's your sex or what's your gender, or how would you go about it?
Yeah, so right, so if say you have, you have their sex and it says female or male or intersex or whatever, and you still kind of want to be like, oh, but we're going to talk about this type of health, like I want to know your specific parts. I feel like my kind of main rules, this actually gets to the kind of bottom, ask on a need to know basis, because especially trans folks get a lot of very invasive questions about their body, and it's not in good faith, right? It's not for their care, it's just because people like want to know. So that's like obviously not super respectful. But my kind of go-to is just like explaining why it's important to know for their care. Like, oh, I want to make sure you're getting like reproductive health care. Like, can you talk to me about what sexual parts do you have? So I think as long as you're explaining why you're doing it, like, oh, I'm asking you this because I want to know about like this type of care. Like, I want to give you the best, most accurate care. What sex organ or whatever it is, right? Like, what parts do you have? So as long as you're explaining why you're doing it, it's fine. Just asking like, oh, what are your genitals? But if you're not like doing sexual health care, it's like, do you need to know that? Maybe not. So yeah, really thinking about why you would be asking certain questions. And yeah.
So I work at Aurora, we just had an upgrade for Epic, and these are the questions that we ask. Because I took pictures of it because I didn't have it. Okay, so one says better support for Epic for trans, intersex, and non-binary patients. And it says legal sex appears to clinical users in legal context. So used when interfacing with payers, regulatory agencies, and other external systems. And it says the drop downs are sex, legal, gender identity, and then it's got sex assigned at birth, and then
Sure.
sexual orientation. So then it has drop downs for that.
Okay.
And then the next one is similar. It says gender identity.
Yeah.
Appears in places used when the user is working with patients, talking to or about patients. And it says used in patient-facing places like My Chart and ADS after visit summary. So again, it's got sex, legal, gender identity, sex assigned at birth, and sexual orientation. And the drop-downs for orientation is female, male, other, transgender, female, male to female, or transgender, male, female to male. Or excuse me, the first one was male to female.
Right. Yeah.
And then the third one they have is sexual orientation is used for decision support tools and reporting. And so on that one again, for the sexual orientation, they have one, bisexual, choose not to disclose, don't know, lesbian or gay, something else, straight, not lesbian or gay. So that's the choices that we have
All right. That's
to
pretty
put
good.
in. So I just thought I'd mention that
Yeah.
because I think healthcare systems
Yeah.
are
Trying.
including this,
Trying.
and
Yeah.
also providing education to providers because there was mandatory education that we had to
Cool.
that we had for
Good.
this too.
And I think that's just gonna support better care.
Right,
Because
right.
then we don't
Yes.
have to worry about how we ask questions and how to get to it, especially if we don't know.
Right.
Right.
Mm-hmm.
So that's
Totally.
great.
That's great.
That is great.
Yeah, so they were just sharing their kind of new intake forms in the different categories. That's great. That's a really good one. And those are pretty good options because drop down can be kind of limiting, but those actually are pretty good. Yeah, it kind of covers a lot of the options. Yeah, so right, I think bigger hospitals and things like that are starting to realize the importance of really asking those things as specific pieces and how it relates to care. So that's great. Yeah.
I worked in a clinic 15 years ago that we provided health care for gay, lesbian, transgender patients. We actually did the hormones, so that's why
Oh, great,
when I
cool.
remember the spironolactone.
Yeah.
And we had a large population. Our physician was gay, and so for mandatory counseling from the clinic, because at that time, I don't know how it is now, but they would, if a person was going to have the surgery, they would live X amount of years as that.
Right. Yes.
So if it was going to be a male to a female,
Yeah.
they lived as a female.
Right.
And so
transition, yeah.
so they did the counseling there, but we did all their healthcare needs,
Oh,
which was
cool.
great. It was a great
That's awesome.
great clinic and some of the nicest people, nicest patients.
Yeah, 15 years ago, that's like rare.
Yeah, it was
yeah, that's awesome. I know, and I think that kind of brings up the point too, where he probably had a lot of patience because LGBT folks, even now, like are desperate to know about LGBT affirming providers. Like one of the most common questions I get in my work is like, do you have a list of providers that I can go to? Do you have a list of counselors? Do you have a list of this, and that? Because they've had a lot of negative experiences, and that's why like a lot of the really good ones are super busy because the word spreads and a lot of LGBT folks see the same people, right? Yeah.
Didn't Freighter Hospital and the medical college just open up
The
a
inclusion
clinic?
clinic.
The inclusion clinic, and then they have one
Yes.
for children too.
Yes, yeah. So right, Freighter opened an inclusion clinic. It's still not enough because it's still, I think, like people come part time from different other places to work at the clinic. So definitely more should be done. But it is a really, really awesome. Like, I mean, I'm glad it exists. That's amazing. And there are some of the bigger hospitals do a lot of good work with that. But I think aside from that, it's kind of hard to find care. Yeah, especially because a lot of those places are in kind of Wauwatosa or kind of a little bit farther out from the city. So I know for a lot of my, like the people I work with, it's like, well, I'm not going there.
Yeah.
But that's like a bigger problem, right? Like how do we kind of really make sure care can reach the people it needs to reach? But yeah, no, I was like super pumped to know about that, the inclusion clinic. That's awesome. And that's the thing too. It's like having inclusive doctors within settings is good, but also like there's so much need that we should look more into having LGBT specific health care places, right? Like that's important. Yeah, so thank you for sharing that intake form. That's great. And I'm glad that a lot of the bigger hospitals here recognize the importance of that because of the huge health disparities and people just aren't going. Okay, and I think you reminded me to say something else, but I forgot. Okay, it's fine. And then, right, so there's the ask now and need to know, right? That's the kind of big overarching rule. And then the second one, which is just kind of, again, LGBT like 101, don't assume people's parts or partners or behaviors. So, thank you so much. So even if, they put on the drop down that they're lesbian, don't necessarily still assume that all of their partners, you know, are going to be women, right, and whatever that means, or are engaging in certain behaviors that you might associate with, you know, being a lesbian. And same with parts too, right? Don't assume someone's parts. And I think a big one as well when we're asking about sexual activity is it's like, oh, are you having sex with, a big one is kind of men, women, or both? What do you actually mean by that? Because you could say, I'm having sex with men, but if you're assuming that all of those men have penises, that might not be true, right? So it's like, okay, I have sex with women, but we're assuming that all those women have vaginas, right? Because that's probably what we're trying to get at, like what kind of sexual health care might someone need. So that's kind of also one that I think even within the field we kind of struggle with that, how to ask that in better ways. Like what types of sex parts do your partners have? Yeah, so thinking about that stuff as well. It's just like thing like just to really just be cognizant of. Yeah, but I'm really happy with the intake forms because that was for most places, that was a huge thing. It was just like, you know, gender, male, female, okay, that's it, you know, and it's not great. So that's like really awesome. Okay, barrier number 2, incompetent providers. So as people talked about, I'm glad that a lot of the bigger kind of medical institutions are doing trainings and kind of making these priorities, but it really should also be happening like earlier on. It should be happening during training. It should be happening in school, like this one, right? So really advocating for trainings and workshops like this one, and then advocating for good policies within your institution. Especially because so many medical programs don't talk about it. And then again, being kind of a good ally and provider really means educating yourself and the providers around you, because not everyone is getting this education. Even if your institution does not support it or give you PD on it. Some do, right? But some don't. And, you know, kind of in spite of that, as a provider, you can still be affirming, right? So, and I can send a lot of this out to a lot of the research, the latest research on LGBTQ health, especially trans health, because that changes all the time. So, this is what you brought up. This actually just reminded me. Okay, you just reminded me of trans health stuff. So, getting or receiving hormones or surgery, medically transitioning, there was kind of this gatekeeping process, right? The general thing was, oh, you have to live as, you know, this gender. A therapist has to, you know, approve it, be like, oh, you're right, you did that. And that was a big barrier for people. And the newest kind of best practice is called informed consent. And there's one clinic here, the Greater Milwaukee Health Clinic, I think it's called, in Glendale. But anyway, so they practice informed consent, but in bigger cities, that's kind of the norm. So it's this idea that if a trans person, they come to you and they say, I want hormones, and they're over 18, it's like, cool, you can have hormones. You are an adult, you made that informed decision. Here's all the, you know, pros and cons, whatever, side effects, you can do it. And there are definitely a lot of still healthcare institutions that don't do that still rely on a therapist letter, right? Or kind of some letter from some external source that's, you know, the person's proving that they're whatever, the gender they say they are. That's not best practice, that's a huge barrier. And I just wish that more people would kind of lead to the informed consent part of it. And I think it's slowly getting there, but again, it depends on the type of place it is.
But I think it's lack of training for the providers to provide the hormones and do the truly, because there's an art to it.
Mm-hmm, right, exactly. So LGBTQ and competent providers. Mm-hmm. If you're not taught about hormones and how to talk about them, how to administer them, how to talk to patients about them, you're probably not really gonna
comfortable.
Right, you're not gonna be comfortable with it. You're not gonna advocate for it. You're not gonna encourage maybe trans patients to be like, oh, do you want to get on hormones? So again, super important to kind of educating yourself and figuring out your hospital's policies on it, right? So consent for hormones, and then your own knowledge on it. And then this is actually a really big one for people who live in kind of a smaller place that might not have LGBT friendly, you know, health places or other resources. Online resources, super useful. I actually have in the notes don't show up on that, right? Okay, so within the PowerPoint, like notes underneath, and Jill has them because she has access to the PowerPoint. I have like a bunch of links to like trans hormones, like 101, and it really goes into like in-depth like medical things around it. So all that stuff.
And I can post that in the class.
Great. Okay, so Candy will post it. Awesome. There's some resources within the notes of these slides. Yeah, easy to find because there's a lot of really cool trans health kind of centers posting all of this stuff online because they know that people aren't getting trained on it. So there's a lot of that online. But again, just if you live in a place that's kind of a city or kind of a place near a city, you should also have resources and referrals available for your clients and your patients. So even if you're like, maybe I'm not the best person for this, sending them somewhere, knowing where to send them to get support, to get patient care, etc. So that's really, really, really important. Because if someone's like, oh, I actually would love to, have a resource on this, and you're like, oh, I don't have any, that's not that's not helpful, right? So, yeah, but thank you for bringing up the hormones thing. I love talking about hormones. Okay. And also, I will say for surgeries as well, it's still very expensive. Most insurance doesn't cover it, right? Like, most of my friends that have gotten top surgery have had to do GoFundMes, right? Raise money. It's like so expensive. So kind of all those barriers as well to medical transitions. Okay, structural barriers. This is a big one. It's hard to, do as one person. But again, knowing the policies, your institution's policies, and your local and state policies. Are the state policies okay? Is there kind of health insurance coverage for trans health? In Wisconsin, this was just a big thing. So I think last year it finally passed that Medicaid will cover trans health stuff. And then also for state employees, it recently passed that they would cover trans health, but I think before that there was a time where they weren't covering trans health needs under state employee insurance. So that was, again, that took a lot of advocates to really push for that. A lot of people were pushing for that. People weren't just gonna decide to do it. And then again, advocating for trainings and workshops like this one, not just for providers, because an institution of healthcare, there's like 1,000 other people that work there, right? It's not just providers, right? It's other kinds of staff. It's like waiting room people, it's receptionists, it's there's so many different points of contact that a patient deals with, and a provider might be amazing, but if they're misgendered by the receptionist, that's like immediately they're like, nope, I'm good, like I don't need to come here. So really thinking about, and administration, of course, right, the decision makers, the people in power, are they being trained? Are they kind of, competent or even just affirming in any way around these issues, right? And then again, recognizing that discrimination means that a lot of LGBTQ people don't have health insurance, right? Or stable jobs or housing. Do you serve people without insurance or a sliding scale? Or can you connect them to healthcare that does? Because you can be as affirming as you want, but if your healthcare is out of reach because of insurance for a lot of people, you're not gonna meet the needs of LGBTQ people because we are more likely to be in poverty and have less health insurance, right? So thinking about those as well, kind of health insurance barriers. Big thing though, right? Like we don't have a lot of control over health insurance things. But just knowing, again, resources if we can't do it. Okay, last one, prevention services. So as a health educator, this is important to me. I do a lot of prevention work. And again, recognizing that discrimination and stress means a lot of people have higher rates of risky behavior and higher rates of violence. And your prevention services acknowledge this. A few examples, eating disorders. A lot of big hospitals have eating disorder clinics. Trans people and gay men have very high rates of eating disorders because of body image issues, because of, like the messages they're receiving, etc. Does your eating disorder kind of literature mention that at all? Probably not, right? Like probably not. So really thinking about that. Tobacco cessation, alcohol and other drugs, all that kind of prevention stuff. Again, LGBT folks are more likely to use tobacco and alcohol and drugs because of stress and discrimination, and also because of like the culture and norms and all that. Again, do all of your prevention services around alcohol, tobacco, and drugs talk about LGBT people at all? A lot of them don't. So really thinking about that. Of course, mental health services and materials. I started this because it's like actually like, to me, I think it's a crisis, especially for trans people, trans folks, like trans women of color, life expectancy, 35. Yeah, because of suicide and because of homicide. Like that's ridiculous, right? That's ridiculous. So really thinking about for trans people, and a new one came out, I think for trans men, it was like huge numbers, right? The rates of suicide ideation, depression ideation, and suicide attempts are like astronomical for trans folks because they're facing such like vast discrimination. I think for youth, it's like 40% of trans youth attempt suicide. It's huge. So if your mental health services don't explicitly talk about LGBT folks or don't have specific services for them or just don't mention it, you are not doing a good job with your services, right? Because this is a huge problem. Again, our center gets a lot of people. We have a lot of community-led support groups. We have some therapists, but it's never enough. Like there's just never enough of that. And then of course, like, because I do sex education, prevention, HIV is the big one, right? HIV prevention talks a lot about LGBT folks, which is good. I'm glad, that's good. But beyond that, right? So inclusion in reproductive health, so beyond HIV. Because again, like, LGBTQ people can get pregnant. Do people talk about that? Not very often. Intimate partner violence and sexual assault, those rates for LGBT folks are pretty high. But if your, assault and violence stuff is just showing heterosexual couples or, all that kind of thing, really not showing LGBT couples or LGBTQ folks like as survivors, not doing a good job, because we exist and we definitely experience a lot of violence and assault. So really thinking about all different pieces, even beyond just an individual provider, but really thinking about all the different things you offer and what it's kind of excluding, right? So yeah, okay, I just talked a lot. Any other questions about the different kinds of barriers or anything like that? So we had disclosure, provider, confidence, barriers.
Yeah, I do have a question back on the what is it, binary gender queer.
Yes.
To me, it's like, today I'm going to be a girl, tomorrow a boy. Is that almost like, if you think of that could be classified for a lot of people, because you have a girl who loves to play baseball and they're very tomboyish, but at the same time they're wearing a dress to go somewhere, but they never classify themselves. So
yes. Yeah. So I know. Well, gender is an interesting one, right? So I will say, actually, the fluidity of the gender today identifies this. That's actually called gender fluid. So if someone identifies as gender fluid, they might feel more like a girl one day, more like a boy another day, etc. So, but that's the interesting thing, right? Like, I think a lot of people might kind of transgress gender roles, right? Like, oh, I'm a girl, but I'm gonna look like a tomboy, act like this, do this, and still identify as a girl, right? Like, they're like, I want to broaden what it means to be a girl. And that's cool, and that's fair. And I think also some other people, right, I feel like it hits a point where it's like, I don't feel like a girl. Like, I don't feel like a girl that wants to, like, change norms. I feel like a boy, and I want to, you know what I mean? So that's a really good question, though, because I think that's the thing. It's like, we want to expand gender roles. Like, anyone could be able to do anything or act any kind of way they want or dress any way they want. And it's really about thinking about, like all of those things exist, right? So it's like, you can be like a more masculine woman, or also like you can be like identify as a trans man, and those people actually might have similar thoughts around their gender, but just like identify in different ways. So it's kind of, that's a good question though, because I think that's a big one where it's like there's a lot of options around gender, and it kind of depends on people's personal, it's like, oh, like, am I feeling like I really just want to like live as this gender?
Well, and I'm hearing it more in that young adult, like teenager, young adult age, and to them it's more common language.
Yeah.
And so I'm just trying to figure it out a little bit better, right?
Yeah.
So, because how can you relate to people better by understanding them better? So,
totally.
It's just that there's so many terms that kind of can fit in different situations.
Yeah.
The same situation might be called many different things. Is that right?
Yeah, for sure. Totally. Well, and that's the thing too, like, sexual orientation and gender are kind of just like, we just made them up. They're kind of just constructed. Like, over time, like 100 years ago, like, gayness wasn't a thing. Do you know what I mean? Like, there wasn't, it was like, people just constructed these terms to fit things that were happening, right? Certain communities of people. So it is interesting because it just constantly shifts and changes over time. So that is true, right? Like, you can kind of fit in a bunch of different things. And I do think the kind of non-binary gender piece is becoming more common with younger folks, because they're like, oh, it's like beyond transgressing like these norms for this thing. It's like, actually, I just like don't want to be part of my, the gender that someone thought I was.
Does that need to feel more unique, and as they like separate into their own identity, or how would you say, you're separating from your parents, you're trying to become of your own? Is that a way of?
I mean, I think, well, that's a good question, because I guess most people are on the younger side, and who knows how we're gonna identify in like 20 years. No, but I feel like for a lot of youth that are non-binary and things, it's more like there might not have been a lot of names for it, so maybe like there was kind of only the box of like, oh, I'm just gonna be like a butch woman or like a masculine woman, and there wasn't any kind of like way to express that outside of that, right, as much. So I think part of that is kind of this more acceptance of like, as your gender, you can identify outside of that. Like you don't have to still identify as a woman and be masculine. And you can, and that's totally fair and legit and really cool. And also, if that doesn't fit for you, there's these other options. And it's actually interesting because I think we have an older adults program, and it's a lot of trans women. And I was talking to someone else about this. I was like, oh, I wonder why we don't see as many really like older trans men. And I think because at that time, there was a very, very kind of vibrant butch scene for butch women and masculine women that might not have existed for feminine, you know what I mean, like men who transgress those norms. So it's kind of interesting, right? It's like changes over time. So maybe you're like now, if that person were born now, maybe they would transition, right? Or maybe they would identify in a different way. But back then it was like, that was, you know, the thing that there was a community around. So I think that's part of it, but I think it's a lot of different things. But yes.
It's interesting.
Yeah, it is interesting. And yeah, I mean, definitely just, yeah, and of course, like, just the baseline is like, I mean, even just trying to understand and trying to really, like, relate or think about how we can make, you know, really understand, like, these different identities is just, like, a good first step, or even, like, second or third step, right? It's just, like, I don't have to fully understand it, but I, like, can respect it and I kind of get it, and that's cool. So definitely, I mean, I think a lot of people, too, like, can't even or don't talk about just gender outside of male and female, right? Like people don't talk about that often. So just even doing that is just a good kind of affirming step. But yeah, totally. Okay. Okay, so we made it. I was gonna do a summary, but I was like, whatever. Basically, there are lots of reasons across systems why LGBTQ folks have worse health outcomes. But regardless of all of that, right, all patients deserve quality affirming care. And then I hope that you learn some concrete ways to help make that happen as a provider or as you go forth into your healthcare settings. Yeah, I think that's it. Thank you. You're all wonderful. And of course, like, here's my email, my phone number. Please, you can reach out, and I can, you know, or Candy can reach out, etc. Comments, questions, resource needs. I got a lot of resources. I still have even more academic resources, practical, all that kind of stuff. So yeah, thank you.
Thank you.
Thank you.
Slide and bring up the panel.